Hi, I am Dr. Shishir Shetty. I'm a professor and head of the Department of Oncology at Apollo Cancer Center, Navi, Mumbai. I'm the lead robotic GI and thoracic surgeon. Today I'm going to talk on colorectal cancers. Uh, why we talk so much of colorectal cancer? If you see over the last, say, 2 decades, the number of colorectal cancers, lung cancer has been increasing. That is why a lot of awareness has been needed. So when people ask me why it is increasing, I owe it to only one thing, and that is lifestyle. And when I talk about lifestyle, I talk about every time. I talk about the correct food, the correct diet, the correct exercise. We all have become lazy slobs and fast food junkies. Now, because of that, unfortunately, the bowel, the original Indian meal, Indian food which we had, is gone for a toss. We are eating more of maida, more of processed foods, and because of that, the amount of cancers, especially colorectal cancers, have started increasing. So, one of the main causes of colorectal cancer has been and will be nutrition, exercise, lack of exercise. So, when I call people that you become lazy slobs and fast food junkies, it automatically means to say that yes, you are a high risk for cancer, especially colorectal cancer. Also, other cancers like lung cancers and prostate cancers. So, people who smoke, drink, they are more prone for these type of cancers. So, how do you diagnose this? So, many of them we say that if you are over the age of 45, then the least at least you should get one time a colonoscopy done, especially if you have some complaints like bloating, constipation. I would say that any adult male, if his hemoglobin has dropped without any known cause, it is very important that you have to rule out cancer. Maybe colonic cancer, bone marrow, anything, but it is important that we rule it out. So, a colonoscopy will tell you whether you got a disease in the large intestine, that is either in the colon, rectum, that is colon is divided into ascending, transverse, descending, and the rectum. So, once we know the disease, we do a biopsy to confirm whether there is a problem. Of all you know, it may be as simple as a hemorrhoid or pile. But understand, hemorrhoid and piles are more common than cancers, but at the same time, you should not, if you have a high suspicion of cancer, you should proceed with the colonoscopy. In our country, many of the times, people assume that it is hemorrhoids and they can't go on conservative treatment or piles, that is called as, and that is why many of the colon cancers or rectum cancers are missed. It's a very unfortunate state. So every adult male or female who's got a pile or a hemorrhoid should undergo at least a scopy to see whether the bleeding is from the pile or whether the bleeding is from the tumor. Alright. Having said that, it is understood that colon cancers are curable cancers. Important if the disease is confined to the colon. If the disease has gone outside the colon, then chemotherapy and radiation. But important is that colorectal cancers are curable and have got good lifespan. So how do we treat that? Essentially, in the days past, we used to do an open surgery for many of the tumors, especially because in India we see large tumors. So an open surgery has been a gold standard. Whether we are saving the sphincter, not saving the sphincter is a different aspect. But a rectum surgery and a colon surgery has traditionally been done. Today we use laparoscope and a robot to do the same surgery. It is not that, robotic surgery does not mean it's robot is used to assist us during the surgery, and it helps us improve our three-dimensional focus, our acuity, our precision, all those things that come into play. We are talking today, there were times when all rectum cancers, sphincters used to be removed, especially. But today, with advanced technologies, we are able to save many of the sphincters. Sometimes, even if the sphincter is involved, we give chemotherapy, radiation, try to reduce the disease and then plan the surgery. We try our best to maintain the continuity, but of course, sometimes it is possible that it may not happen. But Sphincter saving surgery is what the expertise is all about, and that is where most of our interventions like laparoscopy or robotic surgery come into play. It is because we can see, we can go into that narrow area, visualize the tumor, visualize the disease, go beyond that and try to resect and probably try to give a disease-free life. That is where all the expertise lie. Today, even when we talk about after surgery, the recovery is faster and they do very well in life. It's not that you are in the hospital for 10-15 days. Very rarely, if any complication happens, it may so. But as of now, most of the patients would recover and be back in 3 to 4 or 5 days' time. Today, when we talk about this advanced ERAS protocol, we talk about getting the patient back home as early as possible. Moreover, apart from this, we have advanced radiation technologies. Many of the rectum cancers now are given radiation first so that we can reduce the tumor and then we can do the surgery. So these are the new protocols in place where a multimodality treatment, namely radiation and surgery together is used to treat, and they are giving better results. In many times, if the tumor is big, say in the large intestine, then we give chemotherapy first to reduce the size of the swelling and then we proceed with the surgery. So this is about colon cancers and rectum cancers in short. Overall, the prognosis is very good unless it is a bad type of tumor, but most of the times patients do well. Very few of our patients end up with a permanent back, and people think that it is a stigma in the society. It is not so. Today, very rarely we put a permanent back, but sometimes we have to. And in case we do that, then there are ways and teaching mechanisms which will give them a better than normal life, so that maybe during the daytime they may not have to wear a bag at all. So that is where the training comes into play, and we do that quite often. Sometimes it is so very difficult to cover the whole of these colorectal cancers in probably 5 or 6 minutes on this video. But please, if you have any questions that we may help you with, or if you have any queries regarding the treatment of colon cancers or rectum cancers, please do not hesitate to call me, or you can send me an email which we'll try to respond to the best of your satisfaction. Thank you so much.